Hi, and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. What we're going to do in this video is continue the series looking at how to decide on finding a therapist for working with dissociation and choosing and understanding what those therapists are all about. So we've looked at the psychiatry profession in the first video, and in this next video we're going to look at all of the other different types of therapists. Because largely psychiatrists are quite different, they often don't do any therapy, as in psychotherapy, and all the other sorts of therapists generally do. But as I said in the previous video, a lot of psychiatrists do actually do good psychotherapy. So this is the next video looking at that series. We're going to look at the different types of therapists by profession and have a bit of an understanding about regulation, which means safety for the person contracting that therapist to do the work, i.e. the patient, client, service user, whatever you want to be called. And regulation is really important because that's the protection for people. And I want to start by looking at this to say the first thing to remember when deciding on what kind of therapist, what sort of person can work with you therapeutically, assuming you have that choice, is to understand about regulation to make sure that you're safe and you're protected working with them. Regulation ensures that the person is competent and safe and fit to practice, and they often have a code of conduct to follow as a result of their regulatory bodies. So in the United Kingdom, we have things like the HCPC, which is the Healthcare Professions Council, and registers for things like the BACP and the NCPS. So these are formal registers available online, and what they do is they allow you to put in the name of that therapist into that register, and the name will come up and it will show you who they are. That's really important because if a person says they're on a register and you put their name into that register and it does not come up, then that person is not telling the truth, and generally speaking, avoid that person at all costs because that's fundamentally a lie. And membership and registration are different things as well. So a person might say they're a member of a professional body like the BACP, and what that actually means is that they've completed an accredited training course that is ruled by the BACP to be a good training course, that's effective and good for training the therapists, but no one has actually evaluated that therapist in a way outside of that training course. They might have had supervision to say whether they've been trained, but they've not been evaluated to determine whether they're a competent therapist or not, i.e. fitness to practice regulations. So a person can have membership as a result of a training course that they've done, but registration is actually being evaluated and being assessed. So for example, myself being a clinical psychologist, I'm registered with the HCPC, and that means that each year I'm assessed and evaluated to determine whether I continue to be fit to practice in the profession that I'm doing, as in working as a clinical psychologist. So I'm on the register, and if there's any issues or any difficulties, a person can contact the HCPC, report those issues or difficulties, and they go through an investigation, and it either meets a threshold or it doesn't meet a threshold. Same for the BACP, but you have to be registered. That's not mandatory. In the United Kingdom, registration with the HCPC for psychologists, and there are 9 different practitioner psychology titles, and we'll look at the ones that are really relevant to you, I think, in this video. And all of us have to be registered with the HCPC by UK law. Now in the United States, it's very different. You have licensing, so each state has its own licensing regulations. So psychologists, therapists, doctors have to sign up and be licensed under state law. And you can only be licensed to work within that state unless you've got some sort of special arrangement going on between states, as in some of the psychology and psychotherapy practices do. But a lot of the times, therapists are licensed in one state, and that means they can't work or see patients in any other states within the United States. So it's, there are lots of different systems in place, and whichever country you're watching this video in, my recommendation to you is to become very aware of what the regulatory practices are, because first and foremost, regardless of what kind of therapist you're actually seeing, the first thing you need to be aware of is that they are safe and they are fit to practice, i.e. they're not somebody that's just done a 6-month online course, calling themselves a therapist and suddenly setting themselves up to deliver highly specialised work, working with complex trauma and dissociation, because the chances is that they're not competent to do that kind of work. They've just simply passed an ordinary training course and they might call themselves a therapist. It's largely unregulated. A lot of therapy is known to us, sort of registered therapists, as the Wild West, in that it's unregulated. Lots of people can go on very short training courses, often online, often without any evaluation or supervision, and then they can suddenly start seeing people with conditions like dissociative identity disorder, and they probably won't do a very good job of it. They might, but the chances are that they're not experienced enough to do that kind of work. So that's a little bit about regulation, and we'd sort of put a few links in the video description to try and help you understand where those things are. So first and foremost then, types of therapists. Now, none of these are better or worse than providing therapy for complex trauma and dissociation, because counsellors, therapists, psychotherapists and psychologists, they're all very different, but they all fundamentally do the same kind of thing. But the work with dissociation is largely based around a set of guidelines rather than professional skill set. So the actual profession that you're coming into this at is less important than the willingness to work with guidelines, have a full and deep understanding of dissociation and be a very competent therapist to begin with. So I'm not saying any of these are better or worse, they are simply what they are, and it's up to you to choose the type that might be relevant to you, again, if you have the choice. So to begin with, we're going to look at the psychologists, and there are 9 practitioner psychology titles, of which the key ones are clinical psychologists, counselling psychologists and forensic psychologists. The other ones, like sports, science, health, you're probably not really going to be looking at those people to provide psychotherapy, deep therapy for, dissociative work. It's mainly the first 3. Forensic psychologists tend to work in criminal justice settings, so you're more likely to find them in prisons or probation services, and counselling psychologists you're more likely to find in the private sector, and clinical psychologists you're more likely to find working with the National Health Service in the United Kingdom. In America, clinical and counselling, I think very much similar, and forensics, again, that's going to be largely working in prison settings. So the nature of a psychologist is a scientist practitioner, is that we're very highly trained to doctorate level. So we've undergone undergraduate, often master's level, and then postgraduate PhD level study, and we're entitled to call ourselves doctors, but not the medical kind. We are doctors by academic and clinical profession, as in psychologists. So we look at science and we understand psychopathology, and we use the basic tenets of treatment, which is to assess, to formulate, to intervene and to review, and we usually approach things in a very, very structured way. So what kind of psychologist you end up with will largely all approach things in a very similar way, looking at the research evidence, looking at best practice, understanding guidelines, understanding things, and we're very good at writing letters and reports and being able to sort of formulate the case and being able to understand things. And within the practice of psychology, you'll have lots of different modalities, which are different specialized forms. So you might have things like cognitive analytical therapy, you could have cognitive behavioral therapy, dialectical behavioral therapy, you could have EMDR, you could have a whole raft of different things. Doesn't really matter because the guidelines don't require any one thing over another. But you understand that if you're with a psychologist, they'll approach things with a very specific kind of mindset of structure, realistically. Now, the psychotherapists are much more about the deep, the intensive understanding of relational processes, and again, they have their specializations. Psychotherapists are often heavily experienced in doing lots and lots of different types of training courses, and they're really into very specific types of modalities a lot of the time. So it could be like Jungian therapies or, whatever it might be. But psychotherapists have often done lots and lots of different training courses, and to call yourself a psychotherapist, you've got extensive experience, and you're generally going to be very good at understanding the relational processes that take place within the therapy setting. Then we have the therapists, and the therapists can be all sorts of different types. So what you might get is something like a cognitive behavioral therapist. So that's a person who may have done one course, perhaps like a year of university study, and they have trained in a specific type of modality. So you could have like a schema therapist or a cognitive behavioral therapist or whatever it might be. And the training is generally less intense, but they're more focused on one thing. So you could have like a somatic therapist. So if you go to see them, the approach of therapy that you're going to get is largely about somatic work, i.e. it's going to be about body-orientated types of therapy. Now, they're going to be really good at doing that, but they might, depending on how long they've been working for and how experienced they are, they might not be able to step outside of that if needed. So what I hear sometimes is a person has gone to see a specific type of therapist, like a somatic therapist or a cognitive behavioral therapist, and they're great so long as the problem exists within that window, but the therapist is not necessarily competent, trained or experienced to step outside of that window. And what we know about complex trauma and dissociation is often an eclectic approach works really well. the good therapists in my mind are the ones that can be very creative and very flexible about the type of approach that they take to the therapy, and then they can move around between different spheres of therapy as best fits the person that they're seeing. So they're not pigeonholing the patient into the only kind of therapy that they've been trained to do. Again, it depends on what your choices are, and that one type of therapy might be brilliant, but it might not be. Then we have the counsellors, and the counsellors have all sorts of different training, and largely a lot of this stuff can be unregulated. Lots of counsellors do sign up to registrations and they're part of professional bodies and societies, but actually this is the one that's probably the easiest to just go and get a course, call yourself a counsellor, call yourself a therapist, bung a website out on the internet, attract people in, and then hopefully do a decent job. So good counsellors are really good and often take on more kind of very specific pieces of work, so things like bereavement or addiction or impact of health. Counsellors tend to work in more short-term type arrangements, and psychotherapists and therapists tend to work in more long-term arrangements. So again, it doesn't really matter, because there's some fantastic counsellors, there are fantastic psychotherapists, fantastic psychologists, and some rubbish ones. So it's using all of the information that we talked about in the video about how to tell whether your therapist is any good or not, and approach each and every therapist that you might want to interview to see whether they're good enough for you with that. Don't worry too much about the actual nature of the profession, but do check out that stuff about being regulated, because that means you're protected. And if anything goes wrong in that therapy, if they are not regulated, if they're not licensed, if they're not signed up with insurance and registration, all those kind of things, if you have a problem with them, you've got nobody to go to help you out. They'll just disappear. And I hear this a lot, where folks say that they've been in therapy with a therapist of any type, it goes a bit wrong, and the therapist just disappears, ghosts them, they never hear from that therapist ever again. It can be really rejecting, it can feel very abandoning and extremely painful, and you've got nobody to complain to because they're not registered with anyone. So it's a buyer beware type arrangement. Do make sure you ask the questions. So in summary, we've got psychologists, we've got psychotherapists, we've got therapists, we've got counsellors. Those are the main types that pretty much exist all over the place. If someone is calling themselves something really strange and something that you've never heard of as a type of therapy, do some research on it before you jump in with that person and start having therapy with them, and really try and get an understanding, but always ask the same questions that we talked about. How long have you been working for? How experienced are you? How many people have you seen with a condition that I'm looking for help with? Because that gives you a sense of whether or not you're the first person or the 100th person that they've seen, and that really does make a difference. So I hope this has been helpful. As always, please leave comments in the channel afterwards, and I read those, and I'm really interested in what you think of this. So this is a little bit of just an overview of the types of therapists. Please do some research, please look online, understand the nature of the title that the person is giving, either on their website or when you're kind of being connected to them through a referral process. Do feel confident to ask them, okay, I hear that you're this type of therapist. What does that actually mean? Or what does that mean for me? It's really important that you feel confident to ask those questions. So again, hope this has been helpful. Please leave the comments, like, subscribe, share this video as useful, and we'll keep producing some more content in this series. Okay, until the next time, please do take great care.